Good afternoon, everyone, and welcome back to another PMI Shorts. Today, I am thrilled to be joined by Jan Haley and Deb McNeilance. Today, we're going to be talking about our Certified Medical Office Manager Hematology Oncology certification. Whew, that's a mouthful. So, if you're joining us again, you know Jan. Jan Haley is on our faculty, and Jan spent all of her career really in medical office management, both at the private practice setting and at the system level of running practices. Deb McNeilance is currently the Chief Operating Officer at Huron Gastrology, and they've got 35 providers and 2 locations. Jan has been instrumental in the development of the CMOM coursework. Deb was instrumental in development of the business of oncology. Now I'm going to trip myself up calling it HEMONC and one or BOO. Private joke. We call it BOO internally and HEMONC, but it's the same thing. The hematology oncology or business of oncology is what would you say, Deb, an add-on to the CMOM program?
I would say you're taking part of the course and you're just expanding it out to help it make more sense in the business of oncology.
Well
in
said.
That specialty. Mm-hmm.
So for those who are not familiar, let's start out with CMOM. I guess I should say, hi, my name's David Womack. I'm the president and CEO of PMI. All I do is hit record and ask questions. But let's talk about CMOM, Jan, for a quick minute. The Certified Medical Office Manager course.
Yeah, so I was just going to say that's what CMOM stands for, Certified Medical Office Manager. It's actually a nationally recognized program. I think we should definitely mention that, but it's for both seasoned office managers and aspiring office managers. But it really gives the candidate or the student an opportunity to stay competitive. It also gives them confidence in leadership. I hear that so often when I teach this course is, at the end of the course, I feel like I am in the position to lead better. Or the other thing I often hear during this course is, I can't believe I didn't know that. Because the course is broken up into different modules. We cover HR, we cover the financial piece, managed care, compliance. And then the exciting part of this particular program is to have the business of oncology added on to that. And Deb, I'm going to let you explain a little bit about that.
Right. Well, I can certainly identify what you just said, because when I was a student of CMOM, I was a pretty seasoned manager. I'd been in position for probably 20 years. And when I took that course, I would leave daily going, oh my gosh, I thought I knew what I was doing. I can't believe what I don't know. And so I can totally identify with that. But I think when I was in the oncology practices and having that background of the CMOM and having experience as a manager and seeing how complex oncology is, and it really is very complex. And then talking to other managers in oncology, everyone's at such a different level of understanding. Mm-hmm. And I think too, with the integration with private equity groups and the integration with hospital-based departments, it just complicated it even more. So when I would talk to managers at society meetings or outside of the practice, we would often sit and just kind of converse about how difficult things are and how to keep track of things. And, well, what do you do at your practice? And so I started thinking about it, and I thought, this is really hard to manage these big practices. And you have a lot of variances in what you need to know about how to navigate that patient through their journey. And for me, I'm very much patient focused. I am much an advocate for the patient, and that disease is really difficult. And of course, it depends on what you have and what stage you are. But it's not just for the patient, but it's also for the families of the patient. So I think when I started thinking about what do we really need to know when you're in an oncology practice, I realized, first of all, they didn't even know how to contract with doctors. I mean, that's basic. And I know we talk a little bit about some of that in the CMOM, but many of those managers had never even put together a contract for recruitment. So I thought, well, that's something that we probably should cover. And then I talked about the burnout. Oncology has a very high burnout rate for physicians and their APPs. So how do we help them with maybe scheduling a little more creatively, or different things that we can do to help them with that? The other thing was oral oncolytics. Very challenging as the research grows. A lot of the new drugs are going into infusion, or going away from infusion into an oral environment. So if you're not familiar with how to track that, it's difficult to know whether or not your patients are really adhering to the medication program. And then, of course, outcomes are very important for our practices. We want patients to have good outcomes. So if we're not tracking some of those things, it makes it complicated for the patients. The other thing is, yes, David.
Deb, let me back up a second, because you touched on something at the beginning. And Jan, I think you could probably speak to this from a system perspective. And Deb, you actually, you referenced it when we were planning. You mentioned the private equity. And Jan, I'm thinking about the healthcare system. And I'm thinking about people that are within some type of practice within a larger organization and thinking that, oh gosh, somebody else takes care of that.
Right.
And whether it be from an HR or from a finance. And I think one of the number one things we always get, Deb, kind of like you said initially about, gosh, I didn't know that. There's so many bits and pieces of running a practice that, especially when they roll up into something larger, that having that knowledge is well, goes without saying. It's incredibly helpful.
Right.
So, David, I think even when you have office managers in large health systems, they may have that false sense of security. I have an HR person, I have a finance person, I've got someone else who is managing the contract for managed care. But it's still very important for the office manager to understand all of those different pieces.
Right.
If something goes wrong from an HR perspective, it's really happens in the office. So it's the office manager that needs to understand the labor laws and so forth. And I think about finance often in a large health system. They're looking at surgeries. They're looking at different bigger ticket items. They're looking at strategic planning when it comes to finance. It's the office manager that's going to find those little things before they turn into big things. However, if they don't have a trained eye, it just goes unseen. And Deb mentioned contracting, and even contracting with managed care and so forth. It's important for the office manager to understand that somebody else might be doing the contracting, but they have to know what's in that contract to be able to run their office efficiently and effectively, and to stay within the parameters of that contract and know how to be successful in it. So understand quality measures and different things.
Right. Deb, you mentioned earlier walking into other oncology practices and realizing, you all need.
So I had a short, a few years where I was actually a part of a national GPO.
Okay.
So my job was to go and help practices with practice support, not doing their job, but helping them find a solution for whatever they were going through. So very much like what we do kind of when we're teaching, and we have that networking going on within the class, which is very, very valuable with this course. But I think just going into different practices, different sizes, some of them private, some of them are owned by the hospital. I was always amazed. I would always walk out of the practice going, oh my goodness, I can't believe they don't know anything about this. Or, when you would start talking about maybe it was a GPO contract or a rebate or inventory, or I mean, really any of these things that we are address in the business of oncology, they just had such limited knowledge about it. And I just wanted to put my arm around and go, I'll help you. I just need to sit you down for a little bit and I'll help you understand all these things because I want them to be successful.
Right.
And I think, Jan, you're absolutely right about even though they don't do those things, maybe there is another department that handles them. It's important because they could actually make a really big mistake that could cost a lot of money to the practice or the corporation. So it's really, they need to understand that. And if they're in a position where they have others under them, then they have to educate them and train them and mentor them as well. So I just think this course is super valuable in all aspects. I remember having even a nurse manager in one of my classes. And, she was an oncology manager and she just couldn't believe how many things she hadn't even thought about doing or didn't realize the impact it might have. So, I mean, this is a great course. It covers all aspects.
Yeah. And I've heard the same thing, Deb. Almost every time I teach CMOM, I hear that as, I wish I would have known this years ago, or I wish I would have known this so I wouldn't have made this mistake, and so forth. But I think that comes out every single class.
Right. And I think in the CMOM, they talk about, giving a budget analysis or looking to see if maybe a new ancillary or new service line is going to be profitable and when are you going to break even. And so those are things that you can take out of the CMOM course and really maximize them in the business of oncology because you're doing those things too on a larger scale, probably.
Right.
And so, but amazing how many managers don't even know how to do that. And they, it's important as they grow to stay viable with reimbursement decline. You really need to think outside the box anymore and figure out what can you bring into your practice and what am I doing that I'm not actually billing for and things like that. So I think this course makes you start thinking about those things in a whole different way. I also think it makes you a better leader because you realize the impact that you can have on others. And I think that, there's a leadership area in the CMOM course that I think really inspires people to do a better job and understand how to deal with their staff and also patients. Yeah.
It's funny. There's an internal debate on whether this year was the 25th anniversary of CMOM or we actually celebrated it last year. So either last year or this year, the CMOM was 25 years old. I was looking through my notes. Deb, the Business of Oncology launched back in 2016.
I remember.
So it's approaching 10 years old.
That's right. Yeah.
I think that's just phenomenal. I mean, I say this all the time. I think third-party reimbursement specifically, just the way that we earn in healthcare, has got to be one of the most complicated payment platforms on earth. Oncology specifically, layered on top of being in healthcare, it's got to be one of the most difficult specialties reimbursement-wise in healthcare. Put all that in a bowl and mix it.
It is. And it's funny, just yesterday, I was talking to one of my billing managers and we were talking about reimbursement. And there's a drug that has just been launched. It replaced a drug that has been put on the shelf. We can't use that drug anymore. Okay. So we were talking about how do we get paid for this drug? It doesn't have a J code yet, but it's a preferred drug by a payer, so you have to use it. No getting around it. And it's like, okay, we don't have a J code. It's a biosimilar. So we have to go back to the final rule and say, okay, how do we get paid for this? Is it WAC plus 3% or is it WAC plus 7%? So we have to follow that back to the Medicare final rule. It is so challenging. And I just feel so sorry for new people in these roles because it is so much to know. But if you have some kind of a guidebook that can kind of help you get through, at least get to the right place, that is so, so helpful. But these little things, I mean, it's a lot of money. You got to make big decisions. Can we treat this patient in the practice? Do we need to send them out? And then what does that do for your bottom line in your practice?
Absolutely. Jan, let's talk for just a second about the class coming up. So the CMOM part of it is first. The business of oncology is next. But something that you have been doing recently in some of the CMOM classes is the study groups that people can access. Just talk about that for a second.
Yeah, so that's right, David. So we have a study group for CMOM specifically that we meet twice a month, and it includes anyone can join it that is in the CMOM program. So it's nice for the students because they're networking then with students across the country. Everyone may be at a different part of the program, but it really gives a lot of good conversation. In the study groups, we usually start out by covering a module and then opening it up to conversation and doing a few study questions. But the study groups have been very popular and very successful.
And also the people that are doing this self-paced have access to that.
Mm-hmm.
So some people may elect not to join the live webinar and may elect to do it self-paced. They've got access to that as well. I was thinking about the testing, and I don't know how well it shows up on the website, but the testing now is online,
Mm-hmm.
which has been very well received. And I believe for the business of oncology as well. I believe both of them now are online.
Yes, I believe you're right.
That's perfect.
Yes.
That's really great.
Mm-hmm.
Anything that I forgot, Deb?
I think we've hit on a good portion of the course content. I think just really encouraging practices that have an oncology center that are involved in oncology. I think it's a great course for you to really start to shape your practice and to understand maybe what's missing in your practice, and then just to get some self-helps, some guidelines in this course to help you maybe develop some things that you'd like to do in your practice, like survivorship or palliative care or nurse navigation.
A roadmap is always nice.
Mm-hmm.
Jan, anything that we forgot?
I think the only other thing is just really understanding the benefits of certification because it really does validate the candidate's skill set. It's like I said, it really enhances their leadership, their management skills. So I think certification is so important because of that validation.
Can I just plug in here, just
Yes.
just to piggyback on that, Jan? When I was taking the course, I was actually finishing my degree, my first degree, my bachelor's degree. And I took the course content to the college that I was attending, and I asked them if I could have that as one of my credits.
Oh,
And
wow.
they accepted it as a credit, a course credit. They were very impressed with it. So I just wanted to put a plug in case anybody on this podcast, or if anybody's taking the course, if you're in college and you're trying to finish a degree, let them see it. And I have a feeling you'll probably get a course credit for that.
That's awesome.
That's awesome. Funny that you mentioned that, Deb, because David's aware of this, but when I did my master's program, I went through the program very quickly. And I don't recall offhand how many pages and how many months I wrote, but a lot of it was pulling the knowledge that I had not just learned, of course, through the CMOM, but some of the other PMI certifications.
Mm-hmm.
I was able to rely on some of that knowledge that I had learned and was able to go through my master's program pretty rapidly.
That's
fantastic.
fantastic.
I've been in I may be embarrassed also to say how long I've been in healthcare. I've probably at least 35 plus years, but I still have my CMOM book in my office, and I still pull it out. Sometimes I'm like, they have a lot of good helps in there. They have a lot of good pages that you can go refer back to. And I was working on a budget, and I thought, I'm just going to take another look at that budget example in the CMOM course to make sure I'm not missing anything. So, I mean, it is just it's a treasure. You don't want to let that go. You want to keep it close by because you're going to refer back to that all the time.
I've heard
So,
that more times than I can count. That's awesome. Go ahead, Jan.
yeah, I think we did a podcast with Kim a few months ago when she said the same thing, that in fact she had it on her shelf.
She
I've
held it
got
up.
mine down on a shelf here right by my desk that
Yep.
I refer back to quite a bit. So yeah,
That's
you're
awesome.
absolutely correct.
Well, I will tell our audience, if we missed anything, put it down in the comments. Let us hear from you. Let us know if there's something we missed or something you'd like more information on. Be glad to try to help you. And with that, Jan, Deb, thank you so much for plugging in and playing along today. Really
All right.
appreciate it.
Thank
Thanks,
you.
David.
All
Deb,
right.
it's always a pleasure.